Welcome to your Barbados Today evening news update for Friday, August 27. The curfew remains in place, but more measures have been added to the protocols as Barbados recorded a sharp increase in COVID-19 cases, with 48 people testing positive for the virus on Thursday alone. Prime Minister Mia Mottley, who made the announcement this evening, said the changes will go into effect from Sunday, August 29th.
We are going to have to prohibit all visits to nursing homes and elderly care hospitals, elderly care senior citizens homes, geriatric hospital, the district hospitals. Persons will be allowed to drop off packages. The packages will be sanitized, but you're going to have to stop the visiting.
Among the other measures were adjustments to outdoor gatherings and events. Also, church services, including weddings and funerals, will be limited to 25 people, and the length of those services will also be limited.
And there will be a mandatory 6-foot spacing between persons sitting outside of their immediate bubble of family. The length of the service or the ceremony will now be limited to 90 minutes as a result, 1.5 hours. Similarly, meetings of fraternal societies, private or social clubs, civic associations, organizations, from Sunday will be limited to 25 persons. Graduations and receptions will be prohibited for now. This is not forever, and I've already been informed by the Minister of Education that a lot of the graduations have in fact been virtual and that it has gone now well for many people. Bars and rum shops, let me talk. We are going to keep you open. But I am appealing, I'm talking straight to the owners now, to proprietors. We don't want consumption inside of the premises where possible.
Meanwhile, Health and Wellness Minister Lieutenant Colonel Jeffrey Bostic revealed that officials were monitoring another church cluster which accounts for over a dozen positive cases.
We have a church cluster that accounts for about 13 of the positive cases today, and there have been cases associated with this church over the last 2 or 3 days. And this obviously is a worrying thing. And what we're seeing is that with the 3 church clusters that we've had, the situation is that churches now are being held in buildings that have not been designed for such activity with the numbers and the type of things that go on, singing and that sort of thing. So from an environmental point of view, this is beginning to be a problem. And we are watching this very, very closely. We have closed the church for the time being. We have placed in quarantine persons associated with the church through contact tracing. And we are hoping to really nip this one early.
Minister Bostic said he was equally concerned about the 29 children under the age of 12 who tested positive for the virus between August 11th and 26th, as he gave a breakdown of the latest COVID-19 figures.
Looking at the period 18 to 26th of August, and I want to do this because I want to focus on the local testing that we would have been doing. And during that period, 6,934 tests would have been conducted. These are tests of Barbadian residents, 6,934, and we've had 167 positive cases, or 2.4% of the total number of tests. But what has been alarming, and a game changer in a sense, throughout this period, is the fact that we have recorded 29 positive children under the age of 12. 29 positive children under the age of 12. So we've been following the development of the recent increase in cases over the last 4 days in particular.
The rollout of the Pfizer vaccine for children ages 12 years and over got on the way today, and from all reports there was a steady flow of school-aged children accompanied by their parents and guardians at vaccination centers across the island. Education Minister Santia Bradshaw was on location at the University of the West Indies Open Campus and spoke with the media.
Things are going well, and I hope that over the course of the coming days, as we continue to roll out the vaccination centres in communities across the island, that parents who may be a little bit uncertain will start to move in the direction of actually realising that there's very little or no harm in relation to the side effects from this particular vaccine. But this gives us our best chance of protection in relation to not only our adult population, but also ensuring that our children are well vaccinated, and that hopefully we can move towards getting to a point where we can do our face-to-face classes again in the foreseeable future.
In other news, this Friday, Barbados gets itself in a state of readiness in case African swine fever should reach its shores. Minister of Agriculture and Food Security Indawe made the disclosure this morning, along with veterinary officials. They, however, made it clear that there are no cases of the disease in the country at present. The virus was identified in the Dominican Republic back in July. Minister West said that the country must get itself ready as it can ill afford an outbreak.
If we are not careful and we are not putting ourselves in a state of readiness to deal with any event of an outbreak of African swine fever, then the pressure on government can be severe. African swine fever can wipe out the entire pork industry. And all of our farmers, especially those who are involved in backyard farming, who may not be reaching the standards that are required, are at highest risk. And therefore, it is our business to make sure that we bring Barbados to a state of readiness. My team and I presented to the Cabinet of Barbados on Monday at an emergency cabinet meeting, and we've gone through all the details, including how we are going to tackle this at ports of entry, how we're going to beef up be an unlikely outbreak of African swine fever in Barbados.
Senior Veterinary Officer Dr. Mark Trotman said African swine fever is a highly infectious and dangerous disease that only affects pigs. He said it does not affect other species of animals or humans, and he gave a snapshot of Barbados's preparedness plan.
Those preparedness plans have been revolve around four basic pillars. First one is to have a number of preparedness plans in place so that we know what we have to do in terms of preventing it and responding to it. We need to work with our border agencies and also work with the traveling public and with the farming community to put into place enhanced biosecurity measures. The third pillar is to make sure that business as usual continues so we can protect the economy, make sure that our pork industry is not threatened. And the fourth pillar of the response or the preparedness is in terms of communication, making sure that we are timely, transparent, and informative with our messages and consistent with our messages, and try to make sure that we address any issues with respect to misinformation, rumors, incorrect information, or even deliberate fake news or deliberate attempts to sabotage our efforts to make sure we have proper plans in place. So those are the four pillars that we have around how we're going to respond to African swine fever. The first step is to try and keep it out of the country altogether.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region, members of the Nurses Association of Jamaica were back on the job today. However, the association has made it clear that it will be putting pressure on the government if their needs are not met. More in this report from Television Jamaica.
On Wednesday, a number of nurses called in sick, even as hospitals across the island continue to burst at the seams dealing with COVID-19 cases.
Nurses are frustrated. Nurses feel appreciated, unrecognized. There are no areas in the hospital for nurses to rest. There is nowhere for them to take a break. The attention that nurses feel that they should be getting, they are not getting it. And on top of that, the utterances that were made by the Prime Minister really angered the nurses.
But speaking on Primetime News Wednesday, Health Minister Dr. Christopher Tufton said he and his team from the Ministry of Health met with the nurses to talk about the issues affecting them.
I reassured them that there needed to be clarity because the Prime Minister really in his statement did not mention nurses or doctors. I've listened back to the tape. I was there. He spoke to a process of triaging for attention of persons who need help in the healthcare system and the doctor on duty making the call. The truth is that the Prime Minister and by extension the government is very sympathetic to the conditions and the challenges of our nurses and doctors.
President of the Nurses Association of Jamaica, Patsy Edwards-Henry, says since that meeting, another one was called with her members, and they have agreed to return to work until the issues are ironed out.
And finally, U.S. forces were on high alert for more attacks on Friday as they continued assisting with the evacuation of Afghans desperate to flee Taliban rule. More from Reuters TV.
The mission there they performed is dangerous, and is now it's come with a significant loss of American personnel. And it's a worthy mission. They continue to evacuate folks out of that region. I remember my commanders this morning, first thing in the morning, got a detailed briefing about yesterday's attacks and the measures they're taking to protect our forces and complete the mission.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.